Hello, this is Kelly Bone, and I'm here with Dr. Josie Beug and Dr. Lynda Loudon. Today we are going to discuss the roles of vets, vet associate roles, canine nutritionists, holistic pet coaches, and Facebook and other social media in the pet space. It's so important for pet parents to be their pet's advocate and make sure you are taking advice from qualified people. Dr. Loudon and Dr. Beug, can you please give us a brief overview of your background?
Sure. You want to go first, Josie?
You can go ahead and go.
Okay. So I'm Dr. Lynda Loudon. I've been an ER vet for over 24 years and also an end-of-life practitioner. I've always wanted to be that vet who was there when I could save a life and they really needed me, but it was really important for me to be there if I couldn't save them and to give them a peaceful transition. So I have a business called Peaceful Transitions, where I provide home euthanasias. And I left the ER full-time about 2 years ago because I was very frustrated. I was seeing that a lot of the decisions that were being made in the general practice, the standards of care, were leading pets into my ER. And it was very clear to me, but my colleagues didn't either see it or didn't want to see it. And so I realized for me to make a difference and reach these animals before they needed the ER, I needed to go to the guardians. And so I started an online membership called the Dog Mom Society so that I could educate the guardians and that they could demand different ways of caring for their pets, better, safer ways in the clinics, and so that I could support them and help them keep their dogs healthy and make the best decisions that they could. So that's why I'm here today.
That's awesome. And Dr. Loudon, you're located in New York, Long Island?
Yes, I'm on Long Island.
And you also do online consults, if I'm correct?
I do, yeah.
Okay.
But right now we're so busy, I do it only for my Dog Mom members.
Okay.
Yeah.
Okay. And this is Dr. Josie Beug, and she's located in, I believe, Fort Lauderdale?
Yeah, Fort Lauderdale and Miami. I'm kind of a strange one. I went to veterinary school when I found out back in the 1990s that people were practicing holistic modalities in veterinary medicine. And I myself had grown up going to chiropractors and acupuncturists and such. So I graduated when I was in veterinary school in the mid-90s. I created a holistic track in veterinary school by bringing in speakers to the vet school, holistic practitioners at the time, and doing all my externships with them. So when I got out of school, as soon as I had my acupuncture certification, I started a small house call practice in South Florida, because at that point in time, I couldn't find any clinics who would even be interested in acupuncture or any of those modalities. So I created my own practice by going to the patients' homes, which actually I get to see a whole different part of those animals' lives and get to see where they sleep, how they interact with other members of the household, their family. So it is a much more holistic version of practicing. And I essentially was going to get a brick and mortar practice at one point in time, but I find developed such a deeper relationship with the patient and the owners in their house, and I can take my time, and it's just a much more relaxed way of practicing. So I'm certified in acupuncture. I do Chinese herbs, Western herbs, flower essences, some homeopathy. I teach at the Chi University and teach other veterinarians how to find acupuncture points on dogs and cats. And I also have an online program which I'm starting, which kind of delves into our own healing so that we can be grounded and centered for our animals. And I do a lot of I love starting puppies out, and I go all the way to end of care and hospice care in the home environment. So,
and you also do homeland.
Yeah, I do telehealth consults as well. And that's what I'm kind of veering towards. So I will do second opinions on cases. I will do case medical reviews. I can do herbal therapy and things like that, and a lot of nutrition. So based on traditional Chinese veterinary medicine and other modalities I've picked up along the way. So I've been feeding my own animals raw for like 25 years now, and I've been in practice for 27 years. So it's been a long time.
Okay. And I will drop in the links later on. I'll drop the links so that they know where to schedule, get appointments with you and stuff like that. Because that's my number one question I get in my group is how do I schedule an online consult?
Yeah.
You guys are very much in demand. All right. So Lynda, can you please walk us through the different scope of practice for each role so pet parents can understand who can legally diagnose, prescribe, and create treatment plans, and who is there to provide education and support?
Sure, I'd love to. Veterinarians are the only professionals that can legally diagnose medical conditions, prescribe medications, perform surgery, and really create a medical treatment plan. They're trained in pathology, pharmacology, clinical care. We spend a lot of time on these things so that we can be responsible for the decision making for your pet's health. And some veterinarians are also certified nutritionists and pet health coaches as well, holistic pet health coaches as well. Board certified veterinary nutritionists, they are the vets that have gone on for advanced training after vet school in nutrition. They've spent years in residency and clinical training. They can handle the complex medical cases like the cancer patients, the chronic kidney failure patients, and really take that extra step to make formulated diets that are for that specific condition to help that dog or cat, whatever pet it is. The thing about veterinary nutritionists is you do have to make sure that, they have the philosophy that you are in line with when you hire a veterinary nutritionist, because there are still veterinary nutritionists who are more trained within the system and beliefs of emphasizing prescription diets and kibble, right? So you do have to be careful that if you are seeking a veterinary nutritionist, that you pick one that is approaching with fresh food diets and can help you feed a real food diet that is formulated for that specific condition. On the other hand, nutrition coaches or certified canine nutritionists, we hear a lot about them these days. And you want to make sure that, I've had great experiences with vet nutritionists, and I've had canine nutritionists, and I've had really bad experiences with them. So you have to be really careful. I think that there is a place for them, but it is really important to know, did they get a weekend certification or did they get a more advanced nutrition certification and training in order to be able to help you formulate maybe a raw diet, a gently cooked diet for your dog. What formulation tools are they using? That's a great question to ask them if you're looking for a veterinary nutritionist. How are they going to balance whole foods? Do they have one template that they're giving every pet that comes their way? Or are they really going to tailor that to your dog's specific needs? And also, how much experience do they have? And that goes for anything, right? There's green vets that come right out of vet school, and they may not be the person that you want if you have a dog that has a chronic condition. Same with these nutrition coaches. How long have they been doing it? How many cases have they had? Do they specialize in particular cases? If they come across and say, I can treat everything, well, that's a red flag because I can't treat everything, right? If someone really needs homeopathic, I'm going to send them to a homeopath. I have a little dove, a little bird that we have now. I took her to the avian vet last week, right? Because that avian vet, that's all they do. And they're going to be better at taking care of that and knowing how to treat my dove than me trying to, be the hero and say I'm a great vet, I know everything, right? So that's a red flag for any of these coaches or vets. And then you've got and then with the nutrition, I would say, okay, if your dog has a condition, look for that nutrition coach who has been out for a while, has testimonials, ask them for referrals, to talk to some of the clients they've helped. That's really important. The newer ones that are just coming out, they could be great at helping a healthy dog get off kibble, right? Because your vet may not be the best person for that. That nutritionist who that's all they're doing now could help you get that dog off of kibble in a healthy way. Because in the clinics, we have 15-minute appointments a lot of the times, right? So going in and talking for half an hour about nutrition is not possible. So going to one of these nutritionists could really be helpful and just be another person to have on your team for your dog. But it shouldn't be the only person, right? And then there's the holistic pet health coaches. And these coaches can really bring in another level of care for your dog. And it's just like, think about it like us. If I wanted to elevate my health, and I might go to a holistic coach who that's all they're doing, and they're going to help me elevate my health through my lifestyle, through my choices, through my environment, nutrition on not maybe as deep a level as a nutritionist, but they can help me make better choices and create plans. They might help me with reducing inflammation, things like that. Holistic pet health coaches, I think, are a great idea. If I was going to start a brick and mortar right now, I would have nutritionists and holistic pet coaches as part of my whole team, so that when I go in and I'm treating a case and I'm getting them set up, I can say, we do need to talk about nutrition, or I do want some holistic modalities added, and I don't have time to talk about it. I've got this great holistic coach who can come in that I trust and go over that with them and set up that part of their plan. So I love the idea of it. You just have to be careful that you are not relying on them for diagnosis, treatment of severe diseases, and not utilizing your vet. A red flag would be any of these coaches coming in and say you don't need your vet, right?
Or take them off the medication.
Yes.
Taking off medication is a big deal.
It's a big deal. I've had some of them taking dogs off seizure medication that have been on seizure for years, that I've had to come in and deal with and get them back on their meds and add the holistic modalities. And yes, maybe down the road you may be able to wean them off of some, but that's not for you to do, right? Yeah. So that's just an overall picture of the different types of health professionals, coaches that you can have on your team for your dog. But you've got to be careful that you are not relying on one solely, and that you're looking into their background. How are they educated? Are they sitting behind a computer all day, or have they been in the trenches and really treated cases before giving advice on how to elevate your own dog's health or support them through conditions?
Yeah. I just want to chime in a little bit before we go to the next question. I think the other thing to be important that you hit on a little bit is you need to check references. You need to check the references. You need to look online and see what kind of comments there are. There's one person that we know that does not have good comments and good referrals. And if you did your research and you maybe checked in my group or maybe looked at the Better Business Bureau or some of the other things, you would find a lot of information about this person that would be very alarming. And so you need to gut the details. And I like when people come in my group and they ask, it's not my place to take people off of medication. It's not my place to say, don't do this, don't do this. I can say, yes, maybe Adored Beast would help and stuff like that. But when it comes to actual medication and taking people off and giving an actual treatment, you need to go to a vet. That's what they're there for. That's where they're trained with and stuff like that. Don't take a chance, and take it from me. I killed my dog, so I don't want anybody else to do that. All right, so Lynda, you also worked as an emergency room vet in a corporate office. Can you tell us what that experience was like?
Yeah, I took a year and a half. It was actually out of ER into general practice, which was not my realm. And the reason I did it was because it was a transition period for me, and I got asked to go into this corporate office to turn a failing business around. And I was very interested in the business side of things. So I was like, all right, this would be a good challenge because I was thinking of starting my own brick and mortar. Let me go in and see if I can turn the business around. And I did, but it really opened my eyes to what was happening in the general practices. And I couldn't last more than a year and a half. I was out of there because we would be sitting in front of a computer or have lunch and learns where they're, experts who work for the company would come in and say, if you don't give this vaccine, pets are going to die. If you don't recommend our pesticides, you're risking these dogs dying from these diseases, and putting all this fear into the vets. And I also was a little bit vulnerable at the beginning because I was an ER doctor. I didn't give vaccines, right? So I'm sitting there going, really? It didn't take me long for my intuition to be like, you're hurting animals if you keep doing this, right? And it's the bottom line. You're in meetings every month going, you didn't sell enough of these pesticides. You didn't give enough of this particular vaccine. Not about how many animals you healed, not about how many cases you saw that had great outcomes. It was the bottom line every single month. And so you have to really be aware of that and think like, okay, where are these recommendations coming from? Are they truly coming from a place of healing and in the best interest of my pet, or are they coming from someone's bottom line?
Yeah, that's a good point. All right, Josie, so you have a successful practice near Miami, and there's a new role being introduced in Florida and Colorado called a veterinary associate. And you had a couple little blurbs out there on Facebook.
Yeah.
But can you explain this?
Well, I don't think it passed in Florida. I didn't get a chance to look that up or not. So it did pass in Colorado. So they are putting through, because there's this shortage in veterinarians, which actually happened when the corporate takeover of veterinary medicine happened. So I think it's because veterinarians like Lynda, they go and work for a year in a clinic and then they get totally burned out and they're out of there. So, but anyways, so Colorado has this veterinary practice. It's veterinary associate professional, and Florida is trying to pass it as well. So this is a position that they're trying to squeeze in kind of like a physician's assistant, because they're modeling veterinary medicine over after human medicine. So they're taking people with a bachelor's degree in, I don't even know if you have to have a bachelor's degree. The training is 14 months, which is like 2 months over a year. And by the end of it, when they get out, they are going to be able to diagnose animals, make diagnoses, prescribe medications, and do surgeries. Mm-hmm. So when I was in veterinary school, like Lynda said previously, we spent our whole first year studying nothing but anatomy from a physical perspective on down to a microscopic level. Then we spent our whole second year studying nothing but pharmacology, physiology. Well, physiology was first year, but immunology, all these different specialties. And then we spent our whole third year doing nothing but surgery and medicine. So they're cramming all of that information into 14 months into people that don't even necessarily have a background science degree. Because in order to even get into veterinary school in the first place, you had to have basic biology, basic chemistry, basic biochemistry, even up to physics and math and everything else to even get into veterinary school. So I find this extremely disturbing. Now they're saying that the laws are written in different ways, that the veterinary associate, there has to be a veterinarian on site while they're doing this. But if you've got, these corporate clinics, I think, want to hire these people at a much lower rate than they have to pay veterinarians, and they'll have one veterinarian kind of being the supervisor of all these associates. But I wouldn't want one touching my dog. I wouldn't want one doing surgery on my dog. I mean, I was trained in veterinary medicine to do surgery, and when I got out, I spent a whole year as a shelter veterinarian doing 30 surgeries a day, 30 spays and neuters a day for a year. And that gave me confidence to then go into practice and actually do good surgeries on animals. But these people are not getting that type of experience or knowledge or education. So when you go into a practice, ask, is this a veterinarian with a veterinary degree, doctor of veterinary medicine, DVM, and demand to see a DVM if we're going to save our profession. It has to be the consumer and where the consumer is spending the money. And I'm afraid of what's going on with the pet insurance thing. That's a whole nother piece of this puzzle, which is an absolute nightmare. I'm going to be doing some podcasts on that right now because they're dropping people left and right or increasing their monthly insurance premiums to the point where they can't afford them once they actually need them to help their sick animals. And it's horrible what's going on there. So it's consumer beware when you walk through those clinic doors, who you are dealing with and who you're getting advice from.
Now, Josie, yesterday, somebody from Texas posted in my group and said, Kelly, are you aware that Texas is getting ready to pass a law that only a vet can put hands on a pet? It can't be an acupuncturist. It can't be a TCM person or anything like that.
I agree with that, and that's the way it's been. That's the way Florida law was written. When veterinarians began practicing acupuncture, in order to go to the acupuncture certification courses, the TCVM, traditional Chinese veterinary medicine doctor, it's not a holistic pet coach. You have to be a veterinarian. When I wanted to do this way back when in the 90s, I called up the American Holistic Veterinary Medical Association, and I said, I want to practice this kind of medicine. They said, you have to go to vet school first. And I am extraordinarily glad that that was in place, because there is no way I could be helping the animals that I'm helping in the way that I'm doing it without having that background. So the AVMA was defined doing acupuncture as a surgical procedure because you are inserting needles underneath the skin. And if you don't know what you're doing, you can cause damage. Now, in the human field, human acupuncturists are fighting this right now as well, because they have physical rehab people taking a weekend course and going in and jabbing needles into people, causing potential damage to the underlying tissues, not getting the results that they need. And what it does is it weakens all along the whole entire chain. So somebody will go in, oh, I got acupuncture and it didn't do anything. Well, how was your acupuncturist trained? How many years were they doing it? And the same thing with herbs. Oh, I got a free integrative consult on Facebook, and now I'm giving Chinese herbs to my pet. Those Chinese herbs, for me, are sacred medicine, and you need to have a pattern diagnosis on the animal before you prescribe a Chinese herbal formula. Okay, so I think it is a really good idea. Also, there's human chiropractors who are adjusting animals, and I'm not certified in chiropractic, but I've learned enough, and I've gone to enough chiropractors, and I had Pedro Rivera come in and give classes at the veterinary school, and he's like the godfather of animal chiropractic. But you adjust an animal very differently than you adjust a human. And most human chiropractors use much more force when they're adjusting on humans than you need to on an animal. And you can actually injure an animal. If an animal has a partial herniated disc and you adjust them, you can be in big trouble. So the only chiropractor that I recommend in South Florida that I trust, that she works on my own animals, she will demand, she will ask the veterinarian, is it okay if I touch this animal and is if I adjust this animal? And in certain cases, she wants to see x-rays and everything else. She has to get the okay from the veterinarian to touch the animal. So it's very crucial, and it's crucial to keep the integrity and of these modalities in place, that we have some regulation on them.
Right. Okay. The next thing we were going to talk about is, and Josie, you're going to speak to it, is what do you think the pet owner's evaluation criteria should be when they're choosing a vet? And I do have a whole page on my website that gives you questions and things to look for, but I'd like Josie and maybe Lynda to intercede to just say, here's what they would look for and things to be careful of. Because I wish I would have done it differently.
Yeah, I wrote down kind of a list. The first is their philosophy in terms of nutrition. I have gotten reports from board certified veterinary nutritionists that were, recommending feeding rice cakes and hot dogs to the dog. And I'm not joking on this matter. So it depends upon your own philosophy, but the state of, as Kelly knows, the state of pet food at this point in time, I really recommend going to fresh food diets. Now, that doesn't mean you have to do a DIY in your house and make it yourself. There are some extraordinarily good commercial pet foods out there that are being made by companies that I know the formulators. I feed them to my own animals. So you need to know where they're coming from there. Many vets, again, have very little training in nutrition unless they're board certified. But you have to understand that board certified vets are often being trained by the pet food companies, pet food manufacturers themselves. So that's where they're coming from. If the vets are open-minded, at least it can be workable. So, and also, I put in here, some people are very limited where they live in terms of veterinary care that they can find locally. So when I'm working with somebody, whether it's on a house call basis or whether it's telehealth, I always recommend that they keep a good relationship with their local veterinary clinic. You have to have someplace you can go into where you can get a good acute care and where you can have somebody who has eyes and hands on that animal. So I would try to develop a relationship with them, say these are maybe my feeding philosophies, maybe you don't agree with them, but at least, follow some of their recommendations, keep on good terms with the vet, okay? Because you don't want to be left out there hanging with no place to take your animal. Also, look at their educational background. If they say they're certified in something, where did they get the certification? Who was their teacher? Do they want to, I see people all the time, they don't even want to tell people who their teachers were. And that's a big red flag to me. I'm honored to be a student of somebody who taught me, how long was the course? Or was it certified by a larger association or not, like another veterinary association? Years of experience. Have they only dealt with healthy dogs and cats, sick dogs and cats? How do they feed their own animals? How long have they been feeding their own animals that? What formulation method they're using? Is it a computer program? Do they follow NRC guidelines, APCO guidelines? Are they doing an 80-10-10, a prey model, crock pot? There's so many different theories of nutrition out there. So you need to know what they know and what they're using. Do they have an awareness of knowledge of the various commercial diets out there? From veterinary prescription diets to raw diets to freeze-dried to dehydrated to kibble, the pros and cons, how those companies are formulating their diets. That's why I spend a lot of time going to Global Pet Expo talking. I have formulators from the top 3 diets I recommend on my text message on my phone. So if I'm in a client and I need to ask them a question, I can dial into them and say, hey, I have this case here. What do you think? and I go right to the company formulator. Are they willing to provide different options based on a client's needs, available, and money? You know, sometimes you need to go a cheaper route, but you can do that and still have healthy food for your animal. What supplements are they recommending and how many? I spend most of my time these days taking animals off supplements. People spend $300 to $500 a month on powder, supplements, and pills, and they say they don't have enough money for food. I want them off of all the supplements, and I want them on super good quality, excellent, clean food, preferably from sustainable agricultural farms, that I know how those animals were raised, what was put into them. And I want that done before I add anything else into the equation. And 9 times out of 10, you just get them on good food and all kinds of positive changes happen. So that's a huge thing. Herbal medicine. If they're using herbs, herbs are not, they are medicine. Okay, and a lot of our herbs are actually endangered species because people are harvesting them in the wild, not using them appropriately. So you need to work with somebody who's studied herbal medicine specifically. And what schools and where have they studied it from? There's Chinese herbal medicine, there's Ayurvedic herbal medicine, there's wise woman herbal medicine, there's Western herbal medicine. There's some people are using herbs like drugs, which I do not recommend, and others are using formulations. But how do they formulate? I every single week, every single day, I pick up a formulation of herbs, and I'm like, this does not make sense to me from what I know of herbs. I was studying herbs before I went to veterinary school. I was making my own herbal tinctures 30 years ago. So I can evaluate a formulation and be like, this doesn't make any sense. So I tell them, I'm like, don't give it, throw it in the garbage. You know, there's more money down the drain. It's really sad how much people are spending, and they, when they could, because they don't have somebody to guide them in the right direction. So if the patient's diagnosed with a specific medical condition, has this person treated that medical condition in the past, whether it's supplements or food or what have you? And then references for clients. And then this one is the big one at the end. Do they use pressure tactics to sell you? Do they make you feel guilty about how you're treating your animal? Do they play on your emotions and guilt? Do they make promises that they can heal or save your pet? If that type of behavior is going on, that's a huge red flag. I don't make any promises. When somebody calls me up and said, my dog or cat has this or this, can you help me? And I said, we can give it a shot. And, you know, I'm just honest that way. But if they're saying, oh, you know, this, and this, we'll have them live a super long life and everything else, big red flag. You know, really step back and evaluate it. So that's my take on
I think a couple of things that I'd like to add that I've seen in my group recently is we've had a rash of very sick pets in my group who the vet is vaccinating them, even though they're gravely ill. Any dog
I had
that's
one last week.
Yeah.
I had one last week. The vet made a note in the record saying, I am very concerned this dog has been losing weight over the past 30 days. The note right below that in the record was, oh, we gave them the lepto vaccine. I just
had a dog yesterday. They had cancer and seizures, and they're having chemotherapy, and they gave them a vaccine. And then the other thing that we see a lot now is that the vets now are taking the dog back. The parent says, can I please go back with you? And they say no, so they take them back, and then they do a bunch of things that the person didn't approve. And that is unacceptable. As soon as they
I would be calling the sheriff's department and have them arrested for non-consent of treatment. And you do not leave your animal. If they have to take in the back room, you take your animal and you go and you find a clinic where they will not take your animal away from you.
Thank you.
And just stay with your animal. And if they come in with a handful of syringes, you ask them what is in every single one of those syringes. I'm telling my patients, my clients right now, do not get anything injectable in a veterinary clinic. Until you write it down and you go home and you check out what it is.
And you research it, yeah.
You
Yeah.
research it. I've had dogs given Librela, which causes permanent, irreversible damage without consent to from owners. That's non-consensual practice of veterinary medicine. That is illegal. That is illegal and malpractice.
Right.
Yeah.
So for the people watching this, my Saving Pets One Pet at a Time Facebook group, we have a lot of information out there. And we have information on the website. So you can look up a lot of medications like Librela and the prednisones and stuff like that. We have all the side effects, all the things like that. Do your research before you go to the vet. Don't go in there blindly and all of a sudden you're like, oh my God, they're saying they need them and they're really sick, so I should just go ahead. No, you shouldn't. You need to do your research beforehand. That's what being a pet advocate is about.
And
I've had 2 dogs overdosed with methadone, you know.
I'd like to, people use methadone like crazy these days. But
Crazy.
What I would like to say to that, though, is we have to be careful. And as an ER doctor, there are life-saving ER treatments that you may have to say yes to. Like,
Right.
Don't
just
go
like for humans.
Don't go all the way to the other side and freeze and say, oh, I don't know what to do because I've heard the negative side effects of this drug, so I'm not going to do anything. Well, no, get the education, go into our groups, the Dog Mom Society, the Saving One Pet at a Time, go and learn. But when you go into a clinic and your dog's dying and in a very severe state,
do whatever you got to do.
Do what you got to do. And then you have people on your team to rebalance afterwards, right?
Sure.
To help get that microbiome back if they did need epinephrine or lidocaine for an arrhythmia, right? We know all anesthesia, all those really affect the microbiome. They have great impact, negative impact on the microbiome, but your dog may need them to save their life, right?
Yeah. And what I tell people, even with pain medication in those instances, Dr. Loudon, is tell them your dog is very extremely sensitive to opioids. They can use opioids, but they need to use low dose. Because what I have seen is I don't think people are being trained to recognize an opioid overdose or respiratory depression caused by them. So that way they might go lower on the dose or be able to monitor that animal a little bit closer than normally they would. So that way, if they do need pain control after being hit by a car, but they'll, just keep closer eyes on the animal if you say they've had a sensitivity to it before,
And ask, right? What if your dog needs an anesthetic procedure? What is the protocol that you're using?
Yes.
What anesthetics and operative medications is my dog going to get?
Yes.
And be involved in that conversation and the decision making. Not that I expect that you're going to know every single drug, but it also, if someone comes, and I love those clients, right?
Mm-hmm.
And that's a red flag. If you have a vet who is defensive about that, huge red flag. If you have a vet who's welcomes those questions and that conversation and loves that you are that involved in your and advocating for your pet, that's the vet that you want, and be a part of every decision along the way. And when I have a client that comes in that is like that, I'm paying more attention. It's just human nature, right?
Yeah, right.
I'm going to call them before I do anything. And that's another thing. Your dog's hospitalized, say, don't do anything without my permission. 3 a.m., call me if you have to change the treatment plan that we have agreed on. I want to be a part of the decisions.
That's a good point. All right. Well, I just wanted to kind of tell you guys my story. So I personally regret not being prepared before Duncan died from Science Diet. I trusted my vet implicitly. I went in, they would tell me, we need to give him every vaccination under the sun. Science Diet's the best dog food in the world. Give him the Bravecto and all the heartworms and everything. I did everything they told me to. Well, when Duncan died from Science Diet and I realized it was the food, and then I filed a lawsuit and I won, I set out on you guys know I'm a crazy person. I set out researching everything, taking every class and every video I could watch and stuff like that and trying to learn about it. Don't be me. There's a lot of great resources out there like Dr. Beug and Dr. Loudon who are wonderful, and they offer programs that you can join and you can pay a monthly fee and you can access their videos, their learning experiences. You can have meetings with them and stuff like that. And people tell me, well, Kelly, that's really expensive. I don't have the money to do that. Well, you know what? It's also very expensive when it gets really critical and your dog's dying and you're like, oh my God, what do? I screwed up. Be preventative. Don't be reactive. And that's really important. And you pay for what you get with the vets you go to. And when you go to a traditional vet, you're going to get people who are pushing, like Dr. Loudon said, they've got a bill every 15 minutes, and their metrics are based on how much money they make, not on how many pets they save. So please be very cognizant of that. Also, on my website, we have a lot of things that can be helpful to you. There's the one that's how to choose a vet, and I've got a lot of articles from Dr. Josie and Dr. Loudon and other people on there, and tips. I have a checklist of things to look for, so that's a resource, and I'll put that in the links. We also have pet food recommendations, as Dr. Josie said. Those are the best of the best pet foods. We do not recommend kibble in my group because I can't sleep at night knowing that I'm recommending kibble. Now, for those of you who do feed kibble, I do have a section on there that says if financially you're so strapped that you feel that's the only option you have, or you just need something easy, I give you other alternatives. Here's other easy alternatives. Here's ways to freshen up your kibble. Here's places where you could go to, like Asian markets and stuff like that, and get raw meat and stuff like that. So trying to help you. So, please spend some time. And, I think the easy thing is to go into a Facebook and ask a question real quickly, and you think that's the answer. No, it's research. You have to go research. You have to read. And people say, well, Kelly, each one of your pages is like 15 minutes to read. Well, you know how long it took me to put all that stuff together? A long time. But it's important. You got to do your research. I didn't do that, and I have a dead dog. Do not be me.
Yeah.
The other thing is we do have a link that's called K9 Nutritionists, and we only have 2. I am not that comfortable recommending many of them, but the 2 I have are extremely good, and I feel good about them. And they are affiliated with vets. So if you want that link, I will put that in there as well. Also, the other thing that I'll tell you is I am friends with a lot of the K9 nutritionists, and I'm familiar with a lot of them. A lot of them contact me because they want me to promote them. The thing I'm concerned about is that when I see their fees, a lot of times they're as high as the vet's fees or even higher for their nutritionist fee. And to me, that is ridiculous. I personally would not spend that kind of money on a nutritionist. If I could get one that's fairly reasonable, that's $100 or $199, maybe that's a different thing. But when they're charging $500 to $800 a session, that is completely ridiculous, in my opinion. So,
I think that can be a red flag.
Yeah. And
Most
then
definitely.
a lot of times when you go into those meetings with those people, they'll dovetail into, well, let's talk about what medications they're on, and they try to give other advice. That is not their role, and they're not trained to do that. That's what these people on this call are for. So please be very cognizant of that. And I think the bottom line here is do your research. Do not blindly trust a vet. Be prepared. Research the medications before you, like somebody will tell me my dog's really itchy, and I have a meeting on Monday, and they're talking about putting my dog on Apoquel. So I'm like, okay, here's all the information on Apoquel. You need to read every single thing. Here's the other alternatives you can have. Be prepared to discuss those. So don't go in blindly, because you're gonna get caught with your pants down, and the person that's gonna pay you is gonna be your pet. So, and then again. Please visit my Saving Pets One Pet at a Time group. Dr. Loudon's got the Pet Mom Society, the Dog Mom Society, which is really good. There's a lot of good groups. Dr. Karen Becker, her group is wonderful. Inside Scoop. There's a lot of groups that provide great information, but it's not a substitute for a vet. And I think I've got 15 of the greatest holistic vets on my group that help me, and I'm really appreciative of it. So I just want to thank you, Lynda and Josie, for joining us and participating in this video. I hope everybody finds that this is very valuable. I know if I would have heard it 7 years ago, I wouldn't be in the situation I'm in.
Yeah.
And Kelly, one other thing, I did summarize what we talked about today. That I'll give you a link that you can also link to.
Okay.
It's about, keeping your pet safe and making the right decisions about who you include in your dog's health.
Wonderful.
So I'll give you that too.
Wonderful.